Well, I mean, what we're coming back to is ketamine at psycholytic doses. Okay, so that means lower doses, and we don't use, I mean, we don't like the term psycholytic so much as relational. All right,
Mhm.
and so if we can find the right dose for people, and we can with a bit of practice, uh, then we can get people to what we call the relational space. And I'm not sure if we've said this already, but the relational space, what we say to people is we want you to be in a place where the K-hole is calling you. You could drift off, you could have your own journey, but you don't have to answer the K-hole. You can stay present, you can stay interactive, you can relate, you can feel, you can remember. All of that's happening, okay? So when both people, or even if you were doing one-on-one therapy, if your client
Mm.
is in this relational space, what we've heard people describe, and some of it was perhaps given some indication by what we when we read the comments that came after people used ketamine as couple. But basically, I'm just summarizing what people say. They say things like, I felt less defensive. I felt more open. I felt much more spontaneous. The usual censor that decides what I will and won't say tends to become quiet, and I can say whatever honestly comes to mind. Um, it, it's that kind of thing, and also people talk about being more empathic, more curious about the other, more available. They also talk about going deeper. So topics that they would normally, first of all, avoid because they're afraid to go there. They don't have much fear. And when they get there, they go deeper. Okay? They use that word a lot, deeper. They're more free to be vulnerable. They're more free to own their own stuff without shaming themselves.
Mhm.
All that kind of stuff. I probably don't even have it all, but that's the flavor of it. And so when you have a couple doing that, I mean, I think it's fairly obvious that they are going to do deep, connected work and very unlikely to have a fight because neither of them are feeling defensive, neither of them are feeling shamed. And I think when you're doing it one on one with a client where you are in your normal space, but the client is on a relational dose of ketamine, the opportunities to go deep and, I mean, we come back to the word lubricant, okay? Ketamine, ketamine has a molecular effect, but in the relational realm, it's a lubricant. And so it takes good therapies, which normally grind along and have to deal with defenses and fears and all that. And it's like adding oil to the grinding wheels. They just move more deeply, more quickly. So first of all, I have to own that I am not very expert about MDMA. Okay, I think one of the big differences, just for practicality, is that MDMA is a fairly long acting medicine. We're talking about hours, okay?
Mhm.
Whereas ketamine tends to be, well, it's short acting. We've seen people come out in as little as 45 minutes to double that, about half an hour. I mean, sorry, an hour and a half. So it becomes much more doable in terms of having a session. But I've heard it said that MDMA takes you into your life and ketamine gives you perspective on your life. It's more
Interesting.
backed off.
Yeah.
It's more witness consciousness. It's more observing ego. It's more noticing your defenses. It's more noticing your emotions and not being overwhelmed by them. Okay? So again, there are people who might be able to compare these two medicines better than I, but that's what I can offer.